Cellular therapy in general has been a breakthrough in cancer therapy, but in the space of relapsed refractory large B-cell lymphoma, CD19 CAR T cells have dramatically improved patient outcomes. But approximately 50% of patients will not have a durable response to CAR T cells, and treatment-associated adverse events continue to be a problem in the clinic to manage. So there are several potential factors that can contribute to these problems. One is with the CAR T cell product itself. Two would be patient intrinsic characteristics, and three would be tumor intrinsic characteristics. And so here we're primarily focused on characteristics and heterogeneity of the CD19 CAR T cell products that are being infused into the patient. So the answer to that is twofold. Really, what we identified were features that were more desirable and other features that were less desirable. And it's really the mixture of desirable and undesirable phenotypes within the final product that were associated with outcomes. So when we were looking for associations with clinical response measured by PET-CT at the 3-month follow-up, what we found was a significant enrichment of central memory T-cell, CD8 T-cell phenotypes within patients that had a complete response, and less of those within the infusion products of patients that had partial response or progressive disease. We also looked at other measures of response using circulating tumor DNA to measure molecular response within the first week following infusion, which was itself associated with clinical response measured by PET-CT. But when we looked at characteristics associated with molecular response by ctDNA, we found a very strong enrichment for exhausted CD8 T cells amongst those patients that had a poor molecular response.